Hi guys, my name's Sanjay Gupta and I'm a cardiologist in York, and today I wanted to do a video on the subject of high blood pressure. High blood pressure is something that affects a lot of people. It causes a lot of anxiety and concern, and very few people actually know what it means, partly because no one bothers telling them. Um, and I wanted to do a video on high blood pressure. I'll use an analogy to try and make it easy to try and understand what blood pressure really is and how people develop high blood pressure and how you go about treating high blood pressure. Okay, so the first thing you'll try and understand is what is blood pressure. Now, the way you can think of blood pressure is if you imagine that you have a tap and you have a hose pipe attached to the tap, and you have a finger at the end of the hose pipe, not so that it's blocking the water from coming out completely, but it allows water to come out at a certain pressure so that it reaches your plants. All right, so that is the analogy we're going to use. And basically the pressure in the pipe, all right, is blood pressure. It's the same as blood pressure. So the blood pressure is the pressure in the blood vessels. And that is dependent on a few things. Number one, it is dependent on how high the tap is turned on. So if the tap is, how much the tap is turned on controls the pressure. Number two, how much water there is in the pipes. Number three, the stiffness or compliance of the pipe itself, the hose pipe. So if the hose pipe is very stiff, that's going to cause a higher pressure compared to if the hose pipe is nice and pliant. Okay, and then finally, how tightly you have the finger at the end of the pipe also determines pressure. Now, if you can imagine, so ultimately, what is the point of having blood pressure? And the idea is that if you need a certain amount of pressure in the hose pipe to be able to get the water out at the other end to come out at a pressure and hit the flowers that you're trying to water. Okay, too low pressure, if the pressure is too low, the water is not going to come out far enough and not hit the plants. If on the other hand you have too high pressure, then either the water is going to come out too fast and go beyond your plants, or more importantly, it will cause an excessive amount of pressure within the hose pipe, and the hose pipe could get damaged or burst. So that is what blood pressure means. All right. Now, and there are a few things to try and understand. The first thing to understand is that the blood pressure is vital to try and perfuse or try and get blood to the vital organs. You need a certain amount of pressure to get blood to the vital organs. Too low, you don't get blood to the vital organs. Too high, you get excessive amounts of blood and therefore can cause damage to the vital organs. And that's the crucial thing. What are the vital organs? Well, the brain is a vital organ, the kidneys are a vital organ, the liver is a vital organ, the heart is a vital organ. So there are lots of, all our organs are pretty well much vital, but particularly the brain, particularly the kidneys, particularly the heart, these are very sensitive to blood pressure. And it's important to bear that in mind. Now, how is blood pressure measured? Well, blood pressure, when they talk about blood pressure, they talk about two values, okay? The higher value is at the top. It is called the systolic pressure. The lower value is at the bottom. The bottom value is always the lower value, and it's called the diastolic pressure. So when you're thinking of that tap, which is feeding the hose pipe, imagine that the water is coming out in pulses rather than continuously. So when the water is coming out, the highest pressure that is exerted when the water is coming out is the systolic pressure. the lowest pressure that is exerted when the water is coming out is called the diastolic pressure. A lot of people ask me, which is more important? Is it the top number that's more important or the bottom number that's more important? We know that it is the top number that is more important. Okay, the systolic pressure is more important than the diastolic pressure. Now, it is also important to realize a few things. Okay, the first thing is that generally the blood pressure rises during the daytime, during the morning, and falls at night. All right. So the blood pressure goes up. Why? Because your heart rate goes up when you get up in the morning, i.e. someone is turning the tap on. Your stress hormones go up, so there is more pressure exerted on the hose pipe, okay? And therefore, the blood pressure tends to go up. And when you go to sleep at night, the blood pressure goes down because your heart rate goes down. So the tap has been turned slightly lower, and the pipe relaxes because you're not as stressed, and therefore the pressure should go down. And one of the first signs, if you're having high blood pressure, or if you're worried about high blood pressure, or that you're suffering from high blood pressure, one of the first signs is that you lose this diurnal variation. You know, people generally, if you have high blood, if you don't have high blood pressure, you get a nice dip in your blood pressure recordings at night. But if you lose that dip, and if your blood pressure recordings remain high at night, then that tells you that there's something going on. The second thing to say is that in a day, the blood pressure can vary markedly. Okay, so one reading is not enough to tell you whether you have high blood pressure or not. Because remember, for example, you come to hospital, your heart rate goes up because you're anxious. That is turning the tap on further, and therefore the pressure will rise. If you're stressed, for example, that is someone squeezing the pipe a little bit more, and therefore the pressure will rise. You cannot rely on that and say, oh, I have high blood pressure. These are situational changes. And therefore, it is very important that if you want to know whether you have high blood pressure or not, that someone does a 24-hour blood pressure monitor before diagnosing you with high blood pressure, so that you can get an average of what's happening during a 24-hour period. And also you can look for this nocturnal dip in your blood pressure, which tells you that all is well. So the first thing to not worry about is when people say, oh, well, you know, I have high blood pressure, oh my God, what's going to happen? Don't rely on an isolated reading. Wait until a 24-hour blood pressure monitor is done, all right? The second thing to say is that there are a variety of causes of high blood pressure, but some are reversible, okay? Particularly if you're young and someone is saying that you have high blood pressure, or someone does a 24-hour blood pressure monitor and finds you have high blood pressure, then it is really important that you say, well, why is this blood pressure happening? Most of the times in the older population, no cause is found, so to speak, no correctable cause is found. But in the young, there is a much higher chance of finding something which is correctable. Now, let's think about what kind of things can go on which can cause high blood pressure in the young patients. Number one, if there is a kink in the hose pipe, and that is something called coarctation of the aorta. If there is a kink in the hose pipe, that will cause the pressure to go up. So it's very important, if you're young and if you are found to have high blood pressure, that you go and ask your GP to see a cardiologist who will do a scan of your heart and make sure you don't have this thing called a coarctation. Number two, it could be that there is a problem with the kidneys. All right. Now, the kidneys are responsible for getting rid of fluid from the body. If the kidneys aren't working, then you accumulate more. So in essence, what happens is your hose pipe fills with more water than it should, and therefore the pressure will go up. So it's very important that you ask your GP to send you to a kidney specialist to make sure your kidneys are okay. Number three, it's also very important to make sure that your GP refers you to an endocrinologist, because you may sometimes have something that secretes hormones which cause absorption of water, excessive absorption of water, and that can cause the pressure to go up, or cause release of hormones which can cause more pressure on this hose, therefore increase the blood pressure. So I would not let anyone diagnose you with high blood pressure if you're young and say, look, you have high blood pressure, take tablets. No, get investigated first, because there may be a correctable cause. If you correct the cause, you don't have high blood pressure. And that's why it's very important. Now, let's think of what are the other things that can cause high blood pressure. The majority of these things are because of long-standing changes, okay? For example, if you're constantly stressed, or if you lead a very stressful life, if you're overweight, if you're not sleeping at night because you have something called sleep apnea, or if you have chronic insomnia, then all those things are like the tap turning on further than it needs to. So there's more water coming out, and therefore undoubtedly the pressure will go up. If you have chronic kidney disease, all right, then that means that the kidneys aren't working, the fluid that should go out of the body isn't going out, and therefore there's going to be more fluid, and that pressure will go up. Number 3, hardening of the arteries, all right, or narrowing of the arteries. So people who smoke, for example, people who have high cholesterol, for example, and age as well. So as you get older, the pipe gets harder, the pressure will go up. If you smoke, if you have high cholesterol, you get this inflammation in the small vessels. So that is essentially similar to someone pressing at the end of the hose much harder, and therefore the pressure goes up. And sometimes people just attribute, one of the good signs that there's some kind of blood vessel furring up going on, is that the blood pressure starts going up, because often furring up starts happening in the small blood vessels, which is just a gentle increase in pressure at the end of the hose, and that causes the pressure to go up. So that can be a clue that the arteries and the blood vessels are beginning to narrow. So often when we talk about essential hypertension or high blood pressure, which has no reversible cause, the most likely mechanism is either hardening of the arteries, age, or furring up of the arteries. And it's always worth bearing that in mind, okay? Now, the next question then is, what value should your blood pressure be? Well, remember, it's not the first thing to say is that there is no set value. Okay, there is a value decided by a bunch of people in a conference room somewhere who don't know you, and they would say, oh well, an absolute value of 135 over 80 or 135 over 90 is high blood pressure. That's nonsense. All right, I wouldn't rely on just one value. The first thing is blood pressure is not that you have a normal blood pressure and then suddenly you hit this value and you have high blood pressure. That's not how it works. The truth is your blood pressure is continuously going up as you get older and older. And if you have other things going on, like excessive stress, if you have hardening of the arteries, if you have developed, vascular disease, then your blood pressure will continuously go up, perhaps more than expected for your age. And eventually it will hit this target, which people have defined as 135 over 80 or 140 over 90. And then someone says, oh, you have high blood pressure, and they start treating it. But actually, you've probably had about 10 years of high blood pressure before you've hit this value. And therefore, it's very important that if you're finding that your blood pressure is beginning to creep up, you don't wait for it to go to that 140 over 90 before someone says you have high blood pressure, because by that time, the damage is done, you see. What happens is if you have higher amounts of pressure, if there's more pressure, then that causes chronic changes in the walls of the hose pipe, and that will then cause hardening of the hose pipe. And therefore, because you have hardening of the hose pipe, that is an irreversible change in the hose pipe, and that then causes more high blood pressure. It attracts furring up from cigarettes and cholesterol and inflammation, etc. So it's very important not to wait for, not to just feel reassured. Oh, my GP says my blood pressure is 135/80, so I don't have high blood pressure. Tell him to do a 24-hour blood pressure, look to see whether you're dipping adequately at night, get an accurate idea of what your blood pressure should be. In an ideal world, I think, you should try and keep your blood pressure as low as possible, okay? How low is too low? Too low is when you start developing symptoms of the blood not getting to the vital organs. So if you're feeling dizzy, if you're feeling confused, if you're not passing urine, that's too low. But anything above that, I wouldn't fixate on the numbers. I wouldn't worry about what the numbers are. Just feel comfortable that if it's low, it's okay. As long as the blood is getting where it needs to go, that's all that's needed. Then the next question is, okay, if you've been found to have high blood pressure, what can you do about it? Okay, the first thing is look at your lifestyle. Always try with your lifestyle first before resorting to tablets. Tablets are not the answer. Lifestyle is. Look at what you're eating. Try and eat healthy. Try and avoid sugary foods. Try and avoid high cholesterol rich diets. Try and avoid processed foods. Make sure you sleep well. Try and get enough sleep. These days, 1 in 2 people have insomnia. Can you believe that? And that's why we see so much high blood pressure. And therefore, I think it's really important to try and get therapy or whatever is needed to sleep better. If you have sleep apnea, 1 in 5 people now in the population, in the Western world, have sleep apnea. Worth getting that checked out, because treating that will lower your blood pressure. And that's a natural way to lower your blood pressure. 3, get lots of exercise. Exercise is amazing because when you exercise, you're opening up that hose pipe. You're making it more relaxed. And therefore, your blood pressure naturally falls over a few weeks or months of a good exercise. And of course, it's really important to work on your mindset and not be stressed and not have negative emotions like anger, etc. And those are all good for your blood pressure. So I would always try with lifestyle before going on to tablets. In terms of tablets, what can you try? Number 1, you could take something which reduces how much water is coming out of the tap, i.e. turn the tap down slightly. Those are beta blockers or calcium blockers. They have the effect of turning the tap down slightly. Number 2, you could reduce how much water there is in the pipe. So if you take something called a diuretic, like bendrafluozide or a thiazide, then that is in essence getting rid of more water from the kidneys, and therefore the blood pressure will naturally go down. Then you could take something which can open the hose pipe, and those are vasodilators. So things like ACE inhibitors and calcium antagonists. They have things like alpha blockers, doxazosin, etc. They open the hose pipe, and therefore the pressure goes down. And that's about it. So for the majority of people, it's a good idea, if you're going to take blood pressure tablets, 1, that you take them after trying as hard as possible with your lifestyle. Number 2, for a majority of people, often you probably need to take a combination of different medications rather than lots of only one medication. The advantage of taking combination is because they're working in different ways. So for example, if you take a beta blocker, you slow the tap down and take something to open the hose pipe up, that works better than just turning the tap down a lot more. Because then you're predisposed to lots of side effects because you're taking a lot of one agent, whereas if you take a combination of a little bit of 2 separate agents or 3 separate agents, that works more effectively and is less likely to cause you side effects. So I hope this was helpful. I'd love to hear what you think of this video, and I'm really grateful to you all for liking my videos. And if you think this is helpful or will help someone, I'd be really grateful if you could consider sharing it. And I look forward to continuing to do more videos for you. Now, I just want you to know that I have a website, www.yorkcardiology.co.uk. Please, if you want to get in touch with me, do so via the website, because I can keep control of things and I can then answer things systematically. Of course, you can also get in touch with me via my Facebook page. And finally, you can also ring my long-suffering secretary, Jeanette. And one of these days, I'm going to get her on one of these videos so that everyone knows who Jeanette is. And someone said that I did a video on stress, and Springtime said, "Oh, what about poor Jeanette's stress?" And I said, "Oh, I think she's having therapy for the stress." And Springtime said, "Maybe you should pay her more." And I said, "Well, in which case I will need therapy, because it'll increase my stress levels." So, but Jeanette is great. And if you ever want to get in touch with me, give her a ring. So thank you very much, and all the best. Take care.